Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have none other than Dr. Parimala Devi, who is a renowned gynecologist, obstetrician, and colposcopy expert, and also Guinness World Record holder for screening the cervical cancer. She is also doing robotic surgery. But what is more important is she has not forgotten the roots and the basic problems in the women. Many a times, some of the conditions like tuberculosis of the genital organs can be missed. And people, totally they miss, and then they come with the infertility and they say that, oh, we can't have the children, we have this problem. So she is going to tell us about the tuberculosis of the genital system. Welcome, Dr. Parimala Devi.
Namaste.
Yeah, please tell us how the patients come to you with what complaints and how do you suspect and how do you diagnose the case?
First of all, my respectful pranams to you, madam. Tasmai Shri Guruve Namaha. I can never go ahead without giving pranams to my teacher that time, now also, and always my teacher in my heart. Tuberculosis, when I speak, I remember a lot of your classes, actually, you and other professors who were there, because tuberculosis was so rampant in our time way back in 1980, 85. There was to be a big ward where a lot of coughing patients and women, they used to be there. And we all students, when we were posted, we would get scared, oh, where we will also get tuberculosis, because it was so much there, nearly like it was 23 to 30%. Now, as you were all discussing that BCG vaccination at the birth of the baby and these immunization schedules have brought it down. Lot of these schemes have been given by government. Actually, we should appreciate something like a Nishchay Yojana, so many NIFT, so many are there which are all contributory to bring down. But still, because it is a very populous country, ours, it's very difficult to put the uniform rules. So still we have tuberculosis. At this juncture, I want to thank you because for drawing the attention of our women people community for this disease, because as soon as the baby is not happening, menstruation is not happening, we only think of these days only polycystic ovary or infertility, or maybe there is some problem in the uterus. But there is something which is very common yet to be eradicated, is not coming to our notice sometimes, because the eradication of the tuberculosis,
not only that, it can be cured. It can be cured and they can be given a new lease of life. That's important.
Yes.
Okay.
The eradication of the tuberculosis is one important thing, but it takes time. That's what I said. It's a big populous country and people don't follow a lot of the rules. Now also in this one, we should wear mask. To wear mask, somebody have to die because of COVID. Then only they wear mask. That is our attitude. Actually, in some countries, they start using mask from the childhood only. I think it's Japan, because infection is always common. It may not be tuberculosis. When I am speaking to you, you are speaking to me. There will be a lot of droplets, the spit which is exchanging between the two. So because of that.
And do you know, interesting, everybody is interested in cricket. And the fast bowlers, the fastest bowler bowls at the speed of just 98 kilometers per hour. Whereas when somebody with the tuberculosis or pneumonia, they cough at the 166 kilometer speed, the organisms, millions of them are sprayed on the face of the person who's in front.
So this is the
that person is sure to get the infection, whether it is a common cold or tuberculosis or pneumonia, it will come. And that's how we know covering the face and turning to one side and coughing or sneezing and washing the hands is very important, and not many people are aware of that.
You have to tell it again and again, madam. In every talk, I think you should include this, actually, whether it is related or not. So in gynecologist view, why this is important, I want to draw the attention is, usually the tuberculosis means, in the lungs, something like that is involved, like that we say, cough. It is primarily lung disease. But when it starts spreading through the hematogenous spread, through the blood, it can go and deposit itself in the peritoneum.
In any organ.
Lot of fluid. Then it can go to the kidneys also. Then it can go and affect the tube, because these tubes are motile organs. They are in the peritoneum. Like
they're floating.
Like the birds, this one will be almost floating. This one waves. So these fimbria may catch up these tuberculosis bacteria, and it may travel and infect the whole reproductive organs.
Mycobacterial tuberculosis.
Tuberculosis. because these organs, like whether it's fallopian tube or uterus body or cervix, even vagina, all these can be infected, and it will lead to a disease called as pelvic inflammatory disease. The effect of this is a girl or a woman who is in reproductive period is supposed to have her menstruation properly, first of all. She may not
Regularly.
have. If she has also, she will have very less bleeding. Or if at all she gets married and this one, she may come with again and again, madam, I'm not having period. I'm not conceiving. Even though I'm very healthy, everybody is telling that why I'm not getting the baby. And another important thing, she may lose her appetite also slowly.
Yes.
And all the time she complains, she shows her abdomen, I'm having pain.
Pain.
Because there is pelvic inflammation. Very ways these tubercles are sitting and troubling her by making that inflammation. So it is a swelling, everything, and the proper function of the organs are not happening. So these things are very important. So when a lady comes to us, it's not only the tubal plaque, and there may be some other disease, there may be double uterus, there may be a septum, there may be polycystic ovary. These things are there. But what we are forgetting is we have to investigate her for tuberculosis of the reproductive tract also. For that, we should be looking at our colleagues of tuberculosis specialists. They also should
Yes.
see her, and we also should see her. From our side, we should take always one endometrial biopsy. That's very important because endometrial biopsy will give us proper guidance whether it is a
Perfect.
tuberculosis or
Yeah.
something
Precise
else.
diagnosis.
And
Yeah.
another one is doing the tubal testing, that is tubal black testing, because these are actually tubercles are blocking the tube also. So that is one thing. These all these things are done in one time only under anesthesia. Hysteroscopy is inserted. We see the endometrium. Everything is under the vision, madam. Now it's a evidence-based practice these days. We
Medicine.
cannot just
Yes.
blindly take a biopsy, blindly do that this one. So we have to under the take a biopsy. We have to sometimes collect that fluid which is seen. If it's biliary tuberculosis, that's because of small tubercles. I think we all have seen those tubercles will be seen tiny like that sabudana or something like that everywhere on the reproductive organs and other organs also. So taking a biopsy is more diagnostic, and after that we have to counsel the patient if at all it is a tuberculosis, that it will be a disease which is curable. You
Yes.
definitely conceive, and her nutrition importance we have to give, because
Yes.
it is called as Kshaya Roga in Kannada. Because a lot of muscle wasting and the wasting of the body will happen because her appetite will come down.
Yeah.
So because of that, her nutrition and drug regimes and these testings will again bring her back to her health, and she can definitely conceive, even though she has tuberculosis. But we have to be attentive when she comes to us. Once upon a time in Greek time, they used to call, just as an interesting point, this as romantic disease, because they thought like it comes from each one speaking or exchanging their affection to each other. That's why it's called romantic disease, because even a lot of poets also were used to write it can come through people who hold the mic. That may be a
Mic and then
politician or it
singing,
may be a
singer.
singer
Singer.
or somebody. Mic. Same mic when it is used by others, they would get like just to remember our maestro Balasubramaniam, because of the this one he died of COVID.
Corona.
Maybe any reason, because of this tuberculosis are spread through the droplet infection. This is one thing everybody have to follow. As you always say, the hand hygiene, the coughing with covering the face,
Mouth. Yes.
everything is very important. So tuberculosis, even though the incidence is coming down, still it is not eradicated. Like
Yes.
how I keep on telling about cervical cancer as my passion, cervical eradication by 2030, but tuberculosis is still lingering with 199 actually incidents in the world actually. So
Okay.
because of this, our attention, I wanted to give it, and you actually encourage me. Tell about tuberculosis.
Yes.
Tell it is just not disease of lungs.
Yeah.
Tell that it comes to the uterus also, makes the woman more troublesome with her amenorrhea or with oligomenorrhea or with her pain abdomen, infertility. For this, I have to salute you again, because this is a very important point, and again a one refreshing relearning point for most of the practicing gynecologist also, I can say, madam.
Yes. Thank you so much, Parimala. In fact, anyone having the evening rise in temperature, the mild temperature, 99
Yes.
degrees, that's all.
Yes.
And they'll have the
Yes.
night sweating. But they
Yes.
forget. They think it is because of the summer, or they think it is because of the whole day's work and the tiredness and their appetite gone. that should be the indicator that that could be tuberculosis. So they have to go and get themselves tested, get the chest x-ray, get the Monto test, then get the ESR, blood counts, and apart
Yes.
from that, come to the gynecologist why they are having the bleeding is not occurring, why the bleeding is less, why they are not getting children. And one more most important thing is once you diagnose and put them on the anti-tuberculosis drugs, and now the new regimes have come, and
Yes,
you
yes,
please
yes,
tell about that new regime.
yes,
Yeah, please go
yes.
ahead.
There are regimes like before we used to, in nowadays, a lot of injections. Every day coming and taking injections and tablet,
Streptokinase,
everything.
I
But
mean the
now the regimes have become
streptomycin. Yeah.
very simplified. But we usually consult any woman of tuberculosis with a tuberculosis specialist also, because the basic
Yes.
test from their side, we want it. And then we combine our test and both together with a discussion, with the both
Yes.
discipline, combining some drugs maybe one or
And
sometimes
in fact, the
single
government
drug
is
regime also
giving,
is tried.
yeah, and the
Single drug
government is giving double regime and also free of cost. The drug
free of
kit is
cost.
given for the whole
Yes,
month. So they
yes, whole
must
month.
take. And one more important thing is when they are taking the anti-tuberculosis drug, they should not conceive. So they
Ah,
have to consult a gynecologist,
yes,
and
yes,
how to prevent, whether to
yes.
use the condom or what it is, that they have to take instruction from you.
It's a
And
proper
as
point,
long as they're
madam.
taking the antibiotic, whether it is for 9 months or 12 months or whatever it is, during that period, they should not
You should
conceive.
not conceive.
And
No,
once,
no.
yeah, once the consecutively 2 times it is negative, and they are not very sure that nothing is going to, I mean, tuberculosis is not there, it is completely cured, and then only they can go for the conceiving. In case, in spite of that, if they do not conceive, do you find it, look for the any block in that fallopian tube?
Yes, madam.
And
The
how do you do it?
investigations only, we usually do the HSG,
Uh,
hysterosalpingography. But
mm.
as the science has this one, under the hysteroscopy guidance, we push the dye and see then and there only.
Okay,
Laparoscopy helps a
okay,
lot to
okay,
take care of all these
okay.
things. These days, if there
Oh,
is a tuberculosis suspected, sometimes this salpingography and all we don't do, because we are pushing the
yeah, yeah.
tuberculosis.
It will spread.
Uh,
It will
Under
spread.
the
So first
vision, under
treat
the
and then you can.
laparoscopy vision, under the
Mm.
evidence we see and then record the document the findings. From that, a lot
Okay.
of other tests also will be done and biopsy also can be taken. So
Okay.
the one point is that they should not conceive. So the family is to be counseled. The husband and wife should be counseled together, because
Mm.
in the family usually the elders are always after baby as soon as they
Mm.
get married.
Mm.
That is a something like a sanskara also. But
Mm.
we have to be making that this lady will conceive, but after some time, after this drug regime, and the
Yeah.
nutrition importance is to be stressed
Yes.
to the family to see that
Yes.
she's taken care with the nutrition. So tuberculosis
Yes.
is almost going, but as our infections are also increasing because of so many reasons, and
Population.
immunity is a problem these days with people because of their lifestyle also is not good. No proper
Mm.
sleep, no proper diet, processed as your ahara, everything draws the attention. Still, it takes some time, but we have to do our best in our specialty.
And one thing people should remember, tuberculosis is not only lungs. It can occur anywhere in the whole body.
Kidney,
And
yes,
in fact,
bones.
my own friend's daughter, she was a gynecologist working in a hospital in Mumbai before she
Mm,
went to US. And
mm.
after going to US, when she went for the driving license, there was a eye test was done, and then
Oh,
they found that there was a edema inside, and they
mm,
found that there is a brain tumor. So they were
oh,
panicky. And
mm.
then I used my common sense, and in what we are taught is, when everything is there, first thing that you have to suspect is tuberculosis. So I
Yes,
said,
yes,
just put her on anti-tuberculosis treatment. She had a tuberculoma in the brain and
brain.
completely cured, and totally she's all right.
Yes,
And now
yes.
she has 3 children and absolutely fine. And that's how we know what your mind doesn't know, the eyes will not see. So
Yes, yes,
remember,
that is it.
if a woman is having evening rise in temperature and then losing weight and not having a proper menstruation,
Menstruation.
please come to
Yes,
gynecologist, get
yes,
tested, and then see that you become totally normal.
correct.
Thank you very much
Thank
for
you,
a
madam. Thank you so
very
much for this
beautiful and a
topic.
clear
Yes,
presentation.
thank
Thank you.
thank you so much.
Namaskar. Namaskar.